compensation ideally be part of the plan, and asked how this would affect medical malpractice. So the idea behind folding in workers' compensation is that ideally when you get sick, that same doctor who's invested in keeping you healthy can continue to be invested in keeping you healthy. Unfortunately, right now in the workers' comp system, most of the time you have to see a whole nother doctor, and when they think it's not related to your injury anymore, you have to go back to your doctor. And it doesn't provide for good care for you as a patient or consumer. And so what we'd like to see is that the medical portion of workers' comp be covered by a cooperative. You okay? That the medical portion of our workers' comp be covered by the cooperative, and but companies who would still have to pay some workers' comp for the liability portion, meaning if you happen to employ a bunch of people sitting at the top of poles, it's a lot riskier than if you employ people answering telephones, and so there need to be some money set aside for that. But with regard to medical malpractice, the data I've seen suggests that most people sue for ongoing medical costs. And so if you get injured and you know that your medical costs will be covered for the rest of your life, there's less incentive to sue. The other information I've seen that is really unfortunate is that a study was done out of Harvard University that showed that most people who really did get injured by the medical system were never involved in a malpractice claim. And people who are involved in malpractice claims, most of the time it's just because their injury is so devastating. And so there are a lot of injuries that happen that aren't counted for and looked at in any way. And they're actually swept under the rug a little bit because nobody wants to have to pay for them. So if you can get rid of that liability part, then we could look at quality of care instead of who did something wrong and who has to pay.
Can I add a couple things about workers' comp? From an employer's point of view, half of workers' comp is for medical, and the other half is for the time a person's off work and gets paid. From a patient's point of view, when you go to the hospital and it says, did you have this accident at work or in a car or by disease? Now, if you have a disease but we're in a car accident while you're at work, there's 3 things that might cover. That does not mean you're covered 3 times. It means there's 3 companies that fight over who has to get stuck with your bill. So the more people you're covered by, the less chance you're going to get your bill paid. In the future, they won't say, how did you get sick, or how did you have an accident? They'll just say, oh, you're in the cooperative, let's take care of your illness.
The Rocky Mountain News studied 5 different plans that the people submitted. This is the only one that would save the state of Colorado $1 billion. So we ought to work backwards, saying, how are we going to save $1 billion?
Per year?
I would suggest 3 ways. We pay people for not going to the doctor. We pay children for taking care of their parents the last 18 years of their life. Yes. Just like they took care of their children the first.
I think Misa would say you could not pay him enough.
Okay, there's a third thing, and I have Alzheimer's, so I forgot it already.
My full support and thank you very much. I'm wondering why it takes 20 pages to just present this authority, and then once the bill is actually coming, how many pages is it going to take? And that would be a concern that it's not too many pages.
Yeah. So the reason it took 20 pages is that we spent, and I don't know if I even counted them, but we probably spent about 5 talking about what we want to be involved in the system. Things like that mental health is part of it, that it look at when we could start phasing in dental, vision, hearing care, and long-term care benefits. Things around the whole concept of everyone belonging to a patient-centered medical home. And one thing I've not talked to you about yet, because it can be so confusing, is that you don't have to belong to a patient-centered medical home and an accountable care organization if you don't want to. You could just still do what we call fee-for-service medicine, meaning you go see a doctor, your insurance, in this case the cooperative, pays a part, and you pay the other part. And that is also part of this design. And the reason for that was to address concern by a number of people that that I would, as a doctor, for example, that I refuse to work in any system under a salary. Or as a patient, that I refuse to go to a system, that wasn't really very nice. I want to go to Skyridge every time I'm in the hospital. So, but what we do is we bring that down to the patient-provider level or consumer-provider level. So the cooperative says, you can see any doctor you want, but I know that if you went to your patient-centered medical home, it would only cost us $50. So we'll give you that $50 to go see that doctor, but whatever they charge above and beyond that is your bill, your responsibility between you and the physician, and we don't have to spend the money, time, or energy negotiating that price. So you can still cut administrative savings, but give people 100% choice if that's what they want. But they would see what the real cost is of that choice, not a subsidized cost of that choice.
Yeah, I just want to defend myself here. If you look at other states, they took 60 pages or much more. It's demonstrated. You did a good job.
If you're going to have to purchase gap coverage, let's say from an insurance company, are there going to be any ways with the legislation to control the insurance companies from just jacking the premium? I mean, not they always do, jacking the premiums up such that it makes the combination of being a member of the cooperative and having the gap too expensive again.
Right. So you don't have to purchase gap coverage. And I really just say that because I think that there are people who will innovate around how to do that. Remember, the goal is that, and this is another part of that 20 pages, that if you're in the patient-centered medical home and you're seeing your primary provider and you're going to the hospital, you have to go, it's almost like you belong to Kaiser and you have low co-payments and out-of-pocket costs. But if you want to go to that model where you get to see whoever you want and you pay the difference, that might be an area where an insurer chooses to innovate and create a product. So you would only need to even consider that if you decided you wanted to be mostly in that fee-for-service model. The majority of the population, and our goal would be to set it so that it's attractive for 80% of the population, could be in like an HMO model. But I don't want to say HMO because that scares everybody. But in that kind of model where your costs up front are covered, and you don't pay a lot, and you don't need a gap insurance.
Actually, we put a lot of thought into that gap insurance, and that it actually, you're right. If people bought gap insurance, so that they said, "Oh, I don't care how big the gap is, my insurance pays it," the system would break. But all insurance is secondary. So if somebody has gap insurance, that insurance company has to pay the base payment too. It has to pay the whole bundle. So people would be buying insurance for something they could mostly get under the cooperative. And so the insurance product wouldn't be worth its money. So people wouldn't buy it. So it really makes gap insurance financially not a good idea. And if people bought gap insurance, yeah, and they said, and everybody said, "You have gap insurance." We have all these employers. Said, "I'll give my employees gap insurance." Yeah, the system would go out of sight.
I was asking the question because Irene, you seemed to intimate in the press conference earlier that, the legislature could decide, on just a basic package of benefits, and I don't know what basic means, and are there things that are really essential that are not going to be.
Right. Yeah, and that's interesting because it depends on your perspective what basic means. And I'm smiling because 9Health is going to be here on Wednesday, and I think they're giving legislators like free blood draws. I'm not sure, or maybe they have to pay. But I remember I actually got up at the podium as I was announcing the press conference and said, "If you'd like me to tell you which of those blood tests you actually need, I'd be happy to," because there are a lot of things we do in medicine, as Ron mentioned, that don't necessarily benefit your health. And so, but there are a lot of things we do in medicine that we know benefit your health that we don't pay for right now. An example of that would be dental, would be full access to mental health care. But examples of things that we do in medicine that don't benefit your health, I mean, there's easy things, breast implants, plastic surgery, but actually getting 30 blood tests at a health fair does not benefit your health. You know, and so there would be, so when I say basic, I mean if there's good evidence that it's good for your health, it's covered. So if you have a disease like diabetes, we know controlling your blood pressure, controlling your sugar, all that is important, and we would pay for that. But if for some reason, I don't know, I can't think of an example of diabetes, but you know, there might be things that would be paid for. I always also use the example, and I hate to vilify Skyway because I'm sure it's beautiful, but you know, let's say that their costs are such that they can't have people come at the rate that the system could pay them. Then they could charge whatever they wanted, and you can choose to pay that difference out of pocket. And you know, what that acknowledges, and this is one way in which it's not pure single payer, because pure single payer people say everybody has the same. And this is not really the same, because if you have a lot of money, you could choose to buy something more. But the parameters are that 80% of, you make it so good that 80%